Hello, everybody. As Troy mentioned, my name is Anita Vila-Parrish, and I'm here to talk to you today about how a group of industrial and systems engineers got involved in this wonderful initiative. I'd also like to point out Katie Smith, who is one of the PhD students in our department who's here today, and she's presenting a poster tomorrow. If any of you want further details and get into some of the nitty-gritties, please stop by and pick her brain. We'd love to engage with you further outside of today's venue. So specifically, our team was brought in to bring a different perspective to this project. As we know, and as you're hearing from all the speakers today, this initiative is about innovation. It's about looking at a process that's been going on, as you see from Joe's example, for a really long time, over 100 years, and thinking about it in a different way, and seeing if we could apply some of our systems thinking, partnering with our wonderful team here, to come up with some different ways to facilitate the process of delivering these enhanced services that we really would like for community pharmacies to have the capacity to do. So here's just a picture to give you that frame of mind of the change within healthcare today from one that was more focused on maybe number of prescription filled, the volume of patients seen, to getting that patient to be the center of the healthcare process. And we know that this is an initiative nationally today. And within the community pharmacy space, we'd like to move along and be able to deliver these services. But we know that everybody's busy already with the job that they have as outlined today. So how can we create that capacity to do even more with the resources that we have and the technology that we might have at our disposal? This was going to be our view into looking at the workflow specifically of a set of community pharmacies that Katie has been embedded in visiting and collecting that information so that we could, at the end of this process, share what a high-performing pharmacy looks like, not just from some quantitative measures like volume, but really things that are adding value to the patient, including the ability to give these enhanced services and different mechanisms to improve patient care. So we know we are here. Well, we're not here. This was Raleigh, and actually just moved to San Francisco 7 months ago, so sorry for the weather, but it's been what we've been dealing with for months, so tomorrow will be a sunny day. But we started out this journey here at NC State in Raleigh, North Carolina, and visiting a set of pharmacies within the state. We were trying to understand, where are they today? Do we really even understand, given the measures that were important yesterday, where we are today in this value-based framework? And then asking the question, where do we want to go? What does a high-performing pharmacy look like? So maybe it looks like this. Maybe it's in Durham, North Carolina, though an NC State person would never admit that. If you want to be here, how do we get there? That's the question we're all striving to answer. We want to deliver these enhanced services. We have commitment from such a large team in this network to deliver them, but we don't really know how to move towards it. And we want to be able to do that as efficiently as possible. So as we started learning a bit more about community pharmacy in this space, we were also asking our partners in pharmacy, what makes a high-performing pharmacy? Is it looking at CMRs? Okay, so is it pharmacy A or pharmacy B? Which one do you all think is higher performing? Pharmacy A, show of hands. Pharmacy B? Okay, you all know there's going to be a twist, so you're non-committal. I see that. Very good. What if we layer in a little bit more information, not just volume-based, but looking at staffing and resources? Now who might rise to the top in terms of high performing? And then lastly, what if we look at our patient population? As Joe already described, there's going to be a broad base of types of patients visiting specific clinics that might be in a more urban center, rural center of town, and we need to account for that when we think about this notion of high performing. Are we really performing highest given who our patients are, what our resources are, capabilities, resources, technologies? This is really what we want to understand so that we can create that baseline knowledge and help pharmacies move along that path from where they are today to where they want to go tomorrow. So we could take a look at this picture as a depiction of a possible path to get from where we are today to where we want to go. But it doesn't look too efficient, does it? And so that's really what we saw our role to be, is to give our expertise in process optimization, systems thinking, to help us not take a path that looks like this one, that takes an hour and a half, and you'll see Durham is not that far away. So one of the methodologies that we brought in was this concept of value stream mapping. In value stream mapping, based on observations and a combination of interviewing subject matter experts, we actually depict visually what is going on from the moment a patient walks in the door till they walk out of the door with their prescription, and even points before and after that if you're resolving DTPs and needing to reach out to other providers in the system. And what your takeaway should be here is all of the rows here are actually different parts of the process. They could also be different individuals. And so we were interested from that resource perspective, who is involved? Are they the right person to be involved? You know, we want to keep everyone performing and being able to dedicate more time to the tasks where they add the most value. The pharmacists obviously add the most value when they're in their clinical tasks, not doing tasks where staff could be better placed in that position. And we also wanted to understand all of these handoffs. As we know in healthcare, the more handoffs there are, the more errors that could happen, the more miscommunications, the inefficiencies that could rise between handoffs that may not be actually necessary to do so. So we started along this task, visiting this group of pharmacies, as I mentioned before, to create that base of where we are today. And it's very important to understand where you are today, to know that gap between where you want to be today versus tomorrow. And so one of our other takeaways in this process was understanding that there's really these dual functions going on within a pharmacy. There are these clinical roles, and as I mentioned, should be done most value added by the clinicians that are in your pharmacy, the pharmacists, and there's operational roles, and that we wanted to actually look at those both separately to be able to dig into the details of workflow, efficiency, and how these two interacted. So we created this path and we categorized all of the activities that we were seeing under these two different umbrellas, as well as some of the tasks that actually were a bit more of a hybrid between operational and clinical. And why did we do this? Why did we do the value stream mapping, the categorization, and our data collection? Is really for, at the end of the day, to identify where are the opportunities for improvement, as well as to educate ourselves and others on the variety of performance among even the set that was identified by our partners to us as high performing. There's a lot of variability out there. And so just assuming that this is the checklist of tasks that I need to do to become high performing, without that understanding of where you are today, is not really going to give you that great plan that you will need to put forward to actually execute on those goals. So then we looked at all of these different elements of the community pharmacy process and enhanced services, and we identified that there were opportunities among all of these domains in many areas of the process to improve, to become more efficient. And this is just a depiction, and there's a lot more information on the poster, as I mentioned before, but we really wanted to capture these activities in three main buckets. Resources, so who was doing these tasks? Is it the right person? Is it at the right time? Environment, so that goes back to who are our patients? We should have a process that's customized to the knowledge of who those patients are to be most efficient. And then lastly, outcomes. What are those measures? What are those outputs that we want to track over time to understand whether any changes that you do invest and do make affect that end state, either of the patients, of utilization of your employees, etc. So finally, just some parting words here as we try to understand and lay out this baseline of the high-performing pharmacies. As you can see, we're hoping that we're going to develop a much cleaner idea of where you are so that you can develop that plan that is that shortest path for you to improve the pharmacy of tomorrow. And that we would like this path to basically be able to describe your new process as robust. So as there are changes to your patient population and patient mix, that could be something your process could adapt to because you understand the relationship between patients and the process that you've designed. We want it to be responsive. We want to be able to serve our patients, talk to our providers in a way that makes sense. Sometimes time is critical. Sometimes we might have a little more time to execute on a task. And understanding those levels of responsiveness is important as well. And then lastly, resilient. As we know with healthcare reform, things do change in our landscape, and we need to be able to account for that. So these ideas of high-performing metrics, staffing decisions, we want to be cast under what the current environment is today, and as it changes towards the future, that's something else that we bring into our analysis. So lastly, just wanted to leave you with a quote today, but as engineers involved in this process, it's been wonderful to be able to be part of a team who's really embraced this idea of change and moving towards something that is new. Because we know as we want to continuously improve, that inherently means you will be continuously changing. And so it's wonderful to see such a community of healthcare providers that are truly trying to relay that same concept in their practice today. So we're happy to take any questions at this time. Yes?
I'm curious in your studies if you come up with like an ideal physical layout, or if I go to your poster session tomorrow, will I get details on
Yeah, you'll get a lot more details. And so we go into much more detail under all of those categories and have actually created a matrix checking off, which activities were included in which high-performing pharmacies and some more data around that. So we haven't looked at exact layout redesign, right, Katie? But more from a process and all the discrete elements, who's doing them, how long is it taking, how does that affect their capacity to deliver the services, how can we increase that capacity, knowing what we know now. But really, we have seen such a wide range of operating models. Our goal is at the output of this study to have some benchmarks around what truly high performing looks like, and it may be a hybrid. It will likely be a hybrid of what we've observed with also the feasibility of implementing those changes. So, yes?
Did you use Six Sigma as part of your project to do this?
Yeah.
That's the way you build a training method.
Yep. That's a great question. So Lean Six Sigma is a framework. So value stream mapping is a tool that's commonly used both in Lean and Six Sigma. So Lean being the reduction of waste, where waste could be a physical product, like let's say you let a product expire on the shelf. It could also be waste of people and utilizing them to their highest level, which is definitely something we've observed and tried to highlight through our observations. And then value stream mapping being a mechanism to understand the process, because in Six Sigma, you define the problem, you measure, and that measurement phase, which is so critical, is understanding today's state before being able to analyze, improve, and control the other phases of the process. So we've definitely leveraged a lot from their methodology. Something else we really like about Lean Six Sigma is it's very visual. So you can show someone, here's what's going on. Spaghetti diagram's another one where you literally, with a series of lines that look like a spaghetti bowl, depict people's movement. And somebody maybe might say, gosh, I'm so tired, I'm constantly running around, and you say, yeah, let me show you, because the printer's over here, the phone is over there, so down to your layout questions. That's a really good way to be able to depict whether there's inefficiencies due to movement, which maybe you might be able to remedy them by a redesign of the layout. So yeah, lots of great tools there that I think can start conversations, because as engineers, we're not the practitioners. So we need to show this. We need to get validation from the providers that we're working with to see if it makes sense, and to see if any of the opportunities we highlight also make sense to be implemented.
Yeah. I'm just curious about who you interviewed. Was it all chains banners? Was it all independents? What was your spectrum of how did you identify a high-performing pharmacy to interview?
Yeah, so my team over here might be able to take that one, Stephanie. Oh, okay, yeah, the question was, how did we identify the pharmacies? And we actually have several more we're visiting. Have we visited 8 total, Katie? 9. And, something I would say in terms of, these observations is we've tried to have a spectrum and also visit them multiple times, different times of day. We all know that, work can be pretty cyclical in these environments, and we wanted to make sure we don't have assumptions that we've made from, morning rush or afternoon rush that aren't depicted in the middle of the day. So there's an experimental design in terms of the observations.
I have my mic on, so you don't have to worry about it.
Thank you.
So to build off that question, thank you, Anita. So I think we'll go nicely into the next one.